All right, let's sort of illustrate that and clear that up a little bit. Okay, so we're starting with the heart in the middle. Let's label our chambers: left atrium, left ventricle, right atrium, right ventricle. And we know that the aorta, the main elastic vessel in the heart, leaves on the left side, left ventricle. Right, it's gonna go down to the body. We're gonna have a network of capillaries here. It's gonna converge into venules, then into veins, and it's gonna go right back into the right atrium. Okay, it's gonna go from right atrium to right ventricle, and then we're gonna leave the heart once again. We're gonna go leave the right ventricle, and this time we're gonna go up to the pulmonary circulation. This is gonna be reoxygenated at this point. We're gonna leave the lungs once again and head down to the left atrium. Okay, all right. So let's firstly indicate where we have oxygenated versus deoxygenated blood. So we know oxygenated blood is leaving the lungs, freshly oxygenated. It goes to the left atrium, then the left ventricle, leaves the left ventricle via the aorta. And then we get to the capillary beds where we have exchange of nutrients and oxygen. And so we lose that oxygenation here. And at this point, this becomes deoxygenated blood, heading back to the right side of the heart, leaving the right side of the heart once again, and heading to the lungs to be reoxygenated once more. Okay, this should all be a review for you at this point. All right, so this is the basic premise of our circulatory system. Let's identify the pulmonary versus the systemic circulation first. So we know this bit is the pulmonary circulation. And then this bit is the systemic circulation. Okay. We also know that when we speak about the pressure in both of these sides, right, we just mentioned that on the left side where we have arteries, we use mean arterial pressure as our guide, as our measurement for pressure. Okay. On the right side where we have deoxygenated blood, we use CVP, that's our central venous pressure, as our measurement for pressure. Okay. All right, so let's put some values in these vessels. So we mentioned a few slides ago that in order to see a pressure gradient in the systemic circulation, what two vessels do we look at? What two vessels do we consider to see a pressure gradient? The aorta, 1, and the vena cava, 2. Perfect. So we got the aorta on the left side and the vena cava over here. Now, the pressure in the aorta is typically about 85 millimeters of mercury. Okay, and don't get too bogged down with these numbers. In terms of memorizing, I'll talk about what the important parts of this are in a bit. Can you see this? Okay. In terms of the vena cava, the pressure is usually very low, so roughly about 2 millimeters of mercury. Okay, so that's the mean arterial pressure in the aorta and then the central venous pressure of the vena cava. So as we can see, there's clearly a differential here, right? Clearly a pressure gradient. Let's look at the vessels that we compare in the pulmonary circulation. So what two vessels do we compare to see a gradient in the pulmonary circulation? Pulmonary artery, yep. Pulmonary veins, perfect. So on the right side, we have pulmonary artery. And remember that this is a misnomer, right? This is an artery. This is the only time in the body that an artery has deoxygenated blood. And the pressure here is usually roughly about 16 millimeters of mercury. And we said the pulmonary veins on the left side, again, another misnomer. This is the only time in the body that a vein has oxygenated blood. The pressure here is very low, usually about 2 millimeters of mercury or so. Okay. And so what we can see here is that we definitely have a pressure gradient on both of these, in both of these circuits. So let's describe that a little bit better here. Right, so we know that the pressure gradient is equal to the mean arterial pressure minus the central venous pressure. So let's calculate it for the pulmonary side. That's going to be about 6. Flip-flop these. So I flip-flop these. So this is supposed to be 16, and this should be 2. Okay, so we've got 16 millimeters of mercury minus 2 millimeters of mercury, and that gives us 14 millimeters of mercury here. Okay. Likewise, we'll calculate the pressure gradient in the systemic circulation. So once again, we have mean arterial pressure minus central venous pressure, and that gives us 85 millimeters of mercury minus 2 millimeters of mercury, and that's roughly 83 millimeters of mercury. Okay, so in the pulmonary circulation, you have a pressure gradient of about 14 millimeters of mercury, whereas in the systemic side, we have a pressure gradient of 83 millimeters of mercury. Okay, and so the important part of understanding this is talking about bulk flow. So when we look at the bulk flow in both of these circuits, it's equal. It's equal for both sides. What does that tell us? If we have a higher pressure gradient here and a lower pressure gradient here, but somehow the flow of both of these systems is equal, what does that tell us? There is resistance, but more specifically, what about the resistance? Exactly, there's a lot of resistance in the systemic circulation and less resistance in the pulmonary circulation. So we have bulk flow that is equal in both circuits due to varying resistance, right? Due to varying resistance. And so we have a high resistance in the systemic side. And I'll describe what that means in a little bit, okay? And we have a low resistance in the pulmonary side. So basically we have more stuff getting in the way, more impeding forces, although we have a bigger gradient. Whereas here, we have less impeding forces, although we have a smaller gradient. So these equalize to a very similar flow, okay? Let's take a minute to describe exactly what resistance is before we move on. So resistance is the degree to which a vessel impedes or opposes flow. Okay, we'll talk about some factors that affect resistance, but understand that resistance is anything that is blocking. Oops. Sorry, guys, I'm trying to get the focus. Okay. So resistance is anything that impedes or blocks or opposes the natural flow of blood. And we must take the resistance into account in order to look at the flow, okay? So the